Good morning. If you have a child at home who suffers from the problem of bedwetting and you want to understand the nature of the problem and its causes, keep watching this video with me. We can say that bladder control is actually an acquired skill. It took time until my child learned it. We can say that by the age of 5, a child is supposed to have mastered this skill, or at least should not be experiencing it anymore. If wetting or bedwetting happens after the age of 5, we consider it as such. Problem of involuntary urination, or even before that. No, there is absolutely no problem unless there is another underlying cause responsible for the involuntary urination. So we define involuntary urination as the inability to control the process of urination during sleep. This is when a child over the age of 5 does it more than twice a week for a period equal to or greater than 3 months. So age is very important when it comes to starting treatment. We can also divide the issue of involuntary urination into primary and secondary types without attributing it to psychological or emotional causes. Some of the most important factors that can worsen it include, for example, if the child is beaten, if there is shouting at home, if someone they love suddenly leaves, or if they are constantly being scolded. All of this can make the problem worse for the child. The problem of primary enuresis is closely related to genetics and heredity. So if one of the parents has this problem, usually about half of the children might have it too. And this helps us predict when the problem might resolve. For example, if one of the older siblings had it. If the problem was resolved at the age of 9 or 10, then most likely, the child we are treating now will have their problem resolved as well. At the same time, there are other annual or different problems that can cause enuresis, and there are many possible causes. But we should mention that there can be problems in the urinary system itself, such as anatomical issues in the urinary tract, or the presence of some congenital defects in the urinary system. Or there is something called neurogenic bladder, and this is a problem. Dr. Salam, who consults with us on the channel, made a video about it. Regarding this topic, I recommend that you watch this video so you can understand the nature of this disease and how to manage it. We also have other problems. There are issues with the development of the vertebrae and the spine. This causes loss of bladder control and leads to other problems in the lower limbs. Among the well-known problems that can lead to the issue of enuresis after illnesses like diabetes insipidus, and all of this causes glucose to be excreted in the urine, and this takes a lot of time for me. This leads to the child experiencing increased urine damage, especially during sleep, and causes a problem of incontinence, the lira. This is the problem of analgesia, and this causes swelling in the urethra from the rectum and the urinary tract, and puts pressure on the urinary tract due to non-use. After their shared connection in the process of excretion, this leads to the problem of incontinence. The lira is basically a problem for children who sleep very little, or those who have adenoids and sleep without fully emptying their bladder. It is also said that they may experience the problem of urge incontinence. One of the most important causes is urinary tract infections, which are more common in girls. This is accompanied by other symptoms such as pain during urination, intermittent urination, and a feeling of urgency to urinate. This may also result in an inability to completely finish the urination process. Additionally, there might be an odor or a reddish color in the urine. These are most of the causes and the nature of the disease of urinary incontinence after we have understood the nature of the condition. Now, how do we deal with the child and treat them properly? The first thing we do is counseling, or we sit with the parents and the child to help them understand the nature of the condition, and we tell them that this is a temporary illness. It happens frequently, and the child is not to blame for this condition. We shouldn't punish the child or say things that might hurt or shame them. Just because they wet themselves, we also involve the child in the treatment plan, that he should follow the instructions, that he is responsible for his own personal hygiene, and if he urinates involuntarily, he will clean the place where he slept and change his clothes himself, and we will help him. Of course, we will also provide him with things that help him stick to the instructions. Motivational therapy. We motivate the child. This is very important. We must ask the child if they want to be treated or not. The child needs to feel comfortable, to feel that there are people supporting him, not people who annoy him, not people who say hurtful things to him, or even his younger siblings saying things that upset him. Because all of this, when a child improves, can cause a relapse. So, it's important to stick to the instructions we will mention. In summary, these instructions mean that the child participates with us in the treatment plan. So he commits to avoiding what contains a lot of salts, a lot of protein, because these increase his need for water. He drinks a lot of water during the day, and he goes to the bathroom between 4 and 7 times a day. On average, he must go every 2 hours, even if he doesn't feel the urge. He still has to go. The child should do exercises for the bladder muscles, such as bladder stretching exercises, because he needs to hold the water and feel the urge to urinate. He should try to hold his urine for as long as possible to strengthen the bladder muscles. He should do this exercise once or twice a day, and of course during sleep. he shouldn't feel the need to urinate frequently. The child should go to the bathroom right before going to bed and then be woken up an hour or two after falling asleep to go to the bathroom again, along with a reward system. The reward for the child is not for staying dry, but for following the instructions. As long as the child follows the instructions, we give them a check mark or a star, and at the end of the week, they get a prize. If he adheres to the instructions regarding the stimulating treatments and the cheese-based instructions, this will benefit the child from 5 to 7 years old. Maybe. It remains quite sufficient for us to treat the child with it if the child is over 7 years old or if the condition is not improving. With stimulating therapies, by adhering to the instructions, we begin to get into medical treatments. The first thing we use is the alarm. The alarm is a device that is placed in the child's underwear. It is connected to the child's hand. If the child becomes wet, this device or the alarm starts to make sounds and signals to wake the child up. It causes the child to wake up or become alert. With cooperation, it produces results after the first month. We might continue for 3 months and its results are excellent. We consider it one of the most important things in treating bedwetting. If the alarm fails, we can start medical treatments, or we might begin them from the start depending on the doctor's assessment. And these are some medications that have certain precautions. The doctor will explain them to the child. The first treatment we use is the hormone Minirin. It is used for urinary problems before bedtime. It's important that after giving the child the pill or injection, since there's no syrup form, we must reduce water intake for 8 hours to avoid any problems with sodium levels in the body. And it can lead to other problems. Most cases resolve on their own, especially the primary type, depending on the genetic condition. As we mentioned, let's not forget that there is another important type, which is the secondary type resulting from other existing diseases. For example, conditions like diabetes, polyps, constipation, infections in the bladder, anatomical disorders, or congenital defects in the urinary system in children. We must treat these causes, of course. Spinal problems also need to be addressed if they are the reason. When we solve the primary problem, the issue of involuntary urination improves. I hope you benefited from the video, and if you liked it and you want more people to benefit, please give it a like. And don't forget to subscribe. Wishing you all good health.